All right, so you've chosen your healthcare plan and you decided to go with the high deductible health plan. If you're actually still deciding between plans, go watch our other video that covers all the main health insurance plans first. All right, so I'll link that below. Go watch that first and then come back to this. But by the end of this video, I want you to better understand how to maximize your benefits with the high deductible health plan, especially when it comes to the health savings account. All right, so first, what is a high deductible health plan? The high deductible health plan offers lower premiums and higher deductibles. You pay less each month to have this plan, but if you end up having medical expenses, you pay more out of your own pocket with a higher cap. That's what we mean when we talk about the high deductible. This plan typically offers the ability to utilize an HSA, health savings account, to pay for qualified medical expenses using pre-tax dollars. After PPOs, this plan is one of the more common types of plans chosen. It's actually a type of PPO as well. Now, it's similar to the standard PPO plan in that you can generally see in-network specialists without a referral, but the networks for high deductible health plans tend to be larger, so you typically have more options for what's considered in-network. For this type of plan, you usually want to see doctors that are considered part of your network. It's important to keep in mind that with the high deductible health plan, you generally pay more out of your pocket up front for medical expenses before that plan begins to pay for the covered services. Most of these plans cover preventative care like a physical exam with zero out-of-pocket costs, but you might have to pay in full for other doctor visits, prescription drugs, and more. Beyond that, an HSA eligible health plan is much like a traditional healthcare plan, except that it gives you access to an HSA, the health savings account, which can be a powerful savings tool if used properly. All right, so let's cover the high deductible health plan rules. According to 2022 IRS rules, a health plan is considered high deductible and qualifies for that HSA if it has a minimum deductible of $1,400 for individuals and $2,800 for family plans. Qualifying plans must also have maximum out-of-pocket amounts of less than $7,000 for individuals and $14,000 for families. This is the same as the prior year, 2021. Now, who should choose a high deductible health plan? If you expect to have very few medical expenses, this type of plan typically favors you. This is best for someone who is generally healthy, typically young, and doesn't visit the doctor very often, because you pay lower premiums and don't end up worrying about that high deductible cost. Deductibles only really matter if you spend a lot on healthcare, and in that case, the higher the deductible, the more you end up spending. However, it's always hard to anticipate medical expenses for the upcoming year, so you kind of have to bank on not having too many issues for the next year. But you could save a lot of money by choosing this type of health plan if there's a good chance you'll have very little to no medical expenses. Basically, the lower medical expenses, the better off you might be choosing this type of plan. Now let's talk about the HSA, the health savings account. What is an HSA? An HSA is a tax-exempt savings account that you can use to save for and cover the cost of eligible medical expenses. With an HSA, you can set aside money for healthcare costs as a withholding, which can then be deducted from your income on your tax return. This type of thing is similar to your 401k pre-tax withholding, in which the money withheld from your paycheck is set aside, pre-tax, right? And therefore reduces the amount of adjusted gross income used to calculate your tax bill. The funds in your HSA then grow tax-free, just like your 401k. Then you can use them to pay for eligible medical expenses. In a normal brokerage account, you would owe taxes on any gains from investing. The benefit here is that you're not taxed on the money you made from these investments when they're used for medical expenses. An HSA is only available if you have a high deductible health plan, and you can usually open the HSA through your employer plan. What many people don't actually know is that just because your employer may offer that HSA, you can still open an HSA with another provider. More on that in a bit. Now, HSAs are portable accounts, and this means that you don't have to worry about losing your money when you switch jobs like you would with an FSA, a flexible spending account. You also don't have to worry about losing it at the end of the year. Instead, it's yours forever. So with its tax advantages, easy access to savings, and then growth potential, it's an effective savings vehicle that provides benefits today and in the future. Okay, so let's talk about this triple tax savings. This is the key here. By far, the biggest perk of having an HSA is that triple tax saving. First, pre-tax or tax-deductible contributions, tax-free interest and investment earnings, and then tax-free distributions when used for qualified medical expenses. If you're going to spend the money on healthcare costs, contributing the cash to your HSA first will effectively reduce your total costs, right? Like for example, if you have an effective tax rate of let's say 30% and you spend $5,000 on qualified medical expenses through an HSA, that's essentially $1,500 worth of tax savings. Let's talk about HSA limits. HSAs don't necessarily have income limits, which means anyone can use them and get the tax benefits. But the IRS does put a limit on how much you can actually contribute to that HSA. So for the year 2022, you can only contribute a maximum of $3,650 and $7,300 if you have a family health plan. If you're 55 or older, you can make catch-up contributions of up to $1,000 on top of the regular limit each year. You can also have multiple HSAs, so the contribution limits apply across all of your accounts, not just for each one. All right, let's talk about investing in the HSA. This one's key. So healthcare is typically the #1 expense later in your life, right? So if you can start putting away some savings right now and then let them compound over the next 30+ years through investing, this can really add up. You know, some experts say that the average American couple will need about $300K to cover out-of-pocket expenses for healthcare alone, just healthcare, in retirement. The best way to take advantage of the HSA by far is through investing those funds. Some HSAs offer tools that help you choose your investments and then provide automatic rebalancing, while others allow you to select from specific investments, such as stocks, bonds, mutual funds, ETFs, right? For most people, it's likely easiest just to let your funds grow through a broadly diversified ETF that covers the global stock market within that HSA. It's not a recommendation, I'm just saying it's probably most simple. Healthcare costs continue to rise faster than the rate of inflation, and like we always talk about, the only real way to beat inflation is through what? Long-term investing. And in most cases, you have more healthcare costs as you get older. So if you're young and can have that HSA now, you want to think about how to build that savings long-term. According to data from insurance company Genworth Financial, the median annual cost of in-home health aid in 2020 was actually about $55K. A private room in a nursing home cost about $106K a year. Investing in an HSA can allow you to prepare for those expenses in advance. Here's an example. If you invested $200 in an HSA every single month, starting when you were 30 years old, and then earned the stock market, let's say 8% return on average, by the time you were 70, you could have almost $1.3 million, a significant nest egg for your golden years. Account contributions. Let's talk about those. There are a few different types of contributions that can be made to an HSA. Here's what to know about each one. First off, payroll deductions. If you have an HSA through your employer, you can request to have the money deducted directly from your paycheck and then contribute it to that HSA on your behalf. Payroll deductions are beneficial because the money is automatically deducted before taxes. Next, employer contribution. Now, according to the Employee Benefit Research Institute, 46% of HSAs with contributions in 2018 received employer contributions with an average benefit of about $900. These contributions are also not taxed, but these do factor into the IRS annual contribution limit, so you want to make sure you know how much your employer is contributing on top of your own contribution. Individual contributions. If you don't have an employer-sponsored HSA, you can set up your own one-time or recurring transfers from your bank account. Now, setting up recurring contributions can be a great strategy here to help you maximize those savings by taking out the manual aspect. Now, if you also do have a large one-time medical expense coming up, you could take advantage of this one-time deposit by maxing out your annual limit beforehand. There's also third-party contributions. Anyone can actually contribute to your HSA on your behalf, including family, friends, or anyone else. Start dialing. You can even deduct those contributions on your tax return even if you weren't the one who made them. Now, a thing to note here is that in every case outside of the payroll and employer contributions, you or someone else is contributing money that's already been taxed, known as post-tax money, right? But they are tax deductible, and you'll be able to enjoy the savings when you file your tax return for the year. All right, but what can HSA funds actually be used for? One of the most important things to know about HSAs is that the tax benefits work only if you use your funds for eligible expenses. This is key. If you don't, your withdrawals will be taxed as income, and then you'll also be subject to an additional 20% penalty. The only exception is that if you become disabled, die, or reach age 65, you can use HSA funds for non-medical expenses without incurring that 20% additional tax. However, those funds will be considered taxable income. Here are the different types of expenses that are considered eligible by the IRS. First one, medical care. The IRS provides a long list of eligible medical expenses that you can cover with your HSA funds. Now, these costs generally include payments to doctors, hospitals, other healthcare providers, over-the-counter and prescription drugs, imaging such as MRIs, medical services such as home care, and medical equipment or supplies. Vision care. While vision care typically is not covered by a health insurance plan, you can use your HSA to pay for eligible vision-related expenses. This includes things like eye exams, eyeglasses, accessories, contact lenses and solution, eye drops, eye surgery, vision correction, and more. The list even includes sunglasses if they have prescription lenses and you didn't purchase them over the counter. Dental care. The IRS allows HSA holders to use their funds to pay for the prevention and alleviation of dental disease. Preventative treatment includes dental hygienist or dentist services for such procedures as, teeth cleaning, the application of sealants, fluoride treatments to prevent tooth decay. Treatment to alleviate dental disease includes the services of a dentist for procedures such as x-rays, filings, braces, extractions, dentures, and other dental-related ailments. Whew, that's a long list. Now, how can you optimize your high deductible health plan? All right, here's one option. Never use the HSA, right? Instead, pay out of pocket for everything over the years. Save all of your receipts. And then, at some point after you let all your funds grow in that HSA investment account, you can reimburse yourself for all those past expenses. There's no limit. There's no statute of limitations there. Now, the other option here is use that HSA card like a debit card. This is more common, right? Pay for medical expenses now. But the downside of this is you don't get the earnings in the market tax-free. So, if you really want to optimize this plan, set aside your funds, let them grow long-term in that HSA investment account, and then reimburse yourself down the road. Now, that does depend if you have the funds that cover those costs. All right, thanks again. I'm Tony from Wealthfront. Hit that subscribe button if you like this video. We have a lot of great content on just building wealth overall, not just dedicated to health insurance plans. Take care.